Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare ID Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today's guest is Laurence Girard. He's founder and CEO at Fruit Street. Welcome, Laurence.
Thanks for having me on the show.
Yeah, so, for those that aren't familiar with you, tell us a little bit about yourself and Fruit Street.
Well, I was originally planning to go to medical school. And then when I was in college, I was volunteering in my local emergency room while taking a nutrition epidemiology course. And I realized that almost no one does those two things at the same time. You just start to realize that a lot of the people coming into the emergency room have diabetes, heart disease, stroke, all these issues that are often preventable through diet and lifestyle. So I became very interested in public health. And then I became interested in telemedicine because I was volunteering for an education nonprofit that provided free online tutoring through video conferencing for K through 12 students. And so I got interested in telemedicine, but then ultimately became interested in technology and entrepreneurship and applying that to having a social impact in healthcare. And so just went more down the public health route. But what Fruit Street does is we have a diabetes prevention program that's delivered through telehealth and live group video conferencing on Zoom with registered dietitians. Is designed to impact the 1 in 3 adults that have prediabetes, which means they have elevated blood glucose and they have a high risk for developing type 2 diabetes. But 9 out of 10 people with prediabetes don't know that they have it. And so it's a big problem.
Yeah.
The issue with prediabetes is that if people develop type 2 diabetes, they can all have all these different health complications, amputation, blindness, dialysis, heart disease. And that's not good for the patient, but it also ultimately drives healthcare costs. People with type 2 can have $9,600 more of costs per year. And so Medicare became interested in this and they spent $175 million on a clinical trial where they wanted to figure out how to prevent people with prediabetes from developing type 2. And so they enrolled 3,000 patients with prediabetes into a clinical trial. And they had 3 different arms in the trial. There was a placebo arm, another one took the drug metformin, and the third was in a lifestyle intervention that consisted of 22 classes with a lifestyle coach covering topics like diet, exercise, sleep, stress management. The participants would write down what they ate, how much they exercised, and they would weigh themselves in an attempt to lose 5 to 7% of their weight. And what they found was that the lifestyle intervention was more effective than metformin in preventing type 2 diabetes. Yeah, the lifestyle group reduced their risk by 58%. And in patients over the age of 60, they reduced their risk by 71%. And that was published in the New England Journal of Medicine. They did 10 years of follow-up research. 10 years later, the lifestyle group still had lower rates of diabetes than the placebo. And so this research led to Medicare and Medicaid paying for the program, as well as the CDC developing a national public health program where there's now 1,600 organizations delivering the program. Most of them are in-person programs, but the way we deliver it is through telehealth and live group video conferencing on Zoom with registered dietitians. So if you could imagine 1 dietitian and 30 participants video conferencing on Zoom from either their computer or the Fruit Street mobile app, that's how we deliver the program. And then we also issue them a wireless scale and a Fitbit so they can track their weight loss progress and physical activity. And then they can also take pictures of their food in our mobile app and get feedback from the dietitian. And so that's how we deliver the program. It's a very impactful preventive healthcare service.
Yeah, well, that's a great overview. And I personally love the topic because I'm probably in that 9 of 10 pre-diabetes. And my friend actually literally, a good friend of mine got his leg amputated because of it. So, I mean, I'm it's amazing the impact of diabetes on so many health issues. But, as you look at that, like, can we really prevent diabetes? That's my question, and how do you look at that? I mean, because that's quite a claim, right? To say prevent diabetes.
We definitely can. And that's what that Medicare funded clinical trial proved, that you can prevent and reverse prediabetes. And even if you don't prevent diabetes, you can delay it as well. So prediabetes. Which
is valuable.
Yeah, exactly. Right. And with prediabetes, it's typically one way we define it is an A1C between 5.7 and 6.3. So we're now integrating with labs like Quest, where someone could get an A1C test done when they sign up. And by the end of the 12-month program, you could see someone with a 6.0 A1C go back to a 5. I mean, that happens all the time in diabetes prevention programs. So most of it really is diet and lifestyle and not genetics. And so it's absolutely preventable through diet and lifestyle. And you just have to really make the diet and lifestyle changes necessary to prevent type 2 diabetes. But it definitely is preventable. And that's what the research showed that was published in the New England Journal of Medicine.
Yeah. So what is the key? Is it, I mean, obviously lifestyle changes is the key, but what's the key to your program helping people to be able to do that to, then of course have the downstream of effective impacting diabetes risk?
Mhm. Yeah, so there's a lot of people that know that an apple is healthier than a candy bar. And so that's not necessarily what our program is about. It's about getting coaching and social support. And so when you sign up for the program, you're with a dietitian and a group of 30 participants that are all working towards their health goals together. It's almost like a virtual community and support group. So there's 26 classes over the course of a year, where each class is 1 hour long, and every class covers a different curriculum topic. So it could be diet, exercise, sleep, stress management, grocery shopping, cooking, dealing with emotional triggers for bad food choices. And so the dietitian will share some PowerPoint slides and some content, but it's really more of a group discussion where every week the dietitian is facilitating a group discussion where we're talking about, how can we improve our health this week? What are the goals that we're going to set for ourselves? And we find that one of the most powerful parts of the program is the social support that you get from other people in the program. You have these weekly Zoom meetings, but then you're also in a chat group in the mobile app as well, where you're getting encouragement and support from each other as well. And it's really that social support that drives people's motivation and behavior change. And the other part of it is using digital tools like a wireless scale. Weighing yourself every day has been shown to make people more conscious of their weight and to have better weight loss outcomes. You're also using a Fitbit to track physical activity. The recommendation in this program is 150 minutes of moderate physical activity per week, and then taking pictures of your food and logging your diet as well, where we encourage people to do things like have 4 to 5 servings of fruits and vegetables per day. The average American only has maybe 1 to 2, for example. And so a lot of it is common sense things stop drinking soda and drink water, for example, right? There's a lot of people, when they look at diets, they start to get into these obsessions with things like the ketogenic diet or counting calories, which is important, but it's more about making a holistic lifestyle change. It's not just about a point system or counting calories. It's about diet, exercise, sleep, stress management. So you're making a permanent and long-term lifestyle change rather than trying to severely restrict calories for a period of 12 weeks or something like that. So it's more about teaching people how to make a long-term healthy lifestyle change.
And is that what the group's about? I mean, do you have I assume a curriculum, or is it peer sharing, or, what's the dynamics of the community? And I mean, I guess, is it about accountability with the group? Like, what's the key dynamics there?
Yeah, so the curriculum is a CDC developed and managed curriculum called Prevent T2. And so we're required to follow the CDC's guidelines and report our outcomes data to them every 6 months. And so we have what's called full recognition. It means that we're using that curriculum and we're delivering certain clinical outcomes like 5% average weight loss for people that participate for 9 months. In terms of the actual groups themselves, for example, one class might start out with talking about cooking, for example, and the dietitian would explain, here's some, things you should know about cooking, maybe, what oils to use, or talking about different, dishes that might be helpful, and things like the My Plate method, where it's a certain percentage of your plate is going to come from lean protein and then complex carbs and so forth. But the participants might start sharing with each other things like how they fit cooking into their life. And so the dietitian might ask an open-ended question, with all of our busy lives, how do you fit cooking into your life and make time for it? And then participant A might share something with participant B that resonates with them, or they might be sharing recipes with each other, for example. Or in the class on exercise, it would be another open-ended question. What are some ways that we can improve physical activity in our life and fit it into our life? And the participants are learning from each other's experiences rather than the dietitian saying, you must exercise or you must eat this. The dietitians are trained in a technique called motivational interviewing, where they help people almost solve their own problems, where they're helping them to think about their own personal life rather than just saying, okay, have an apple instead of a candy bar, but how do you actually fit that into your own life? And then I think that participants are sharing success stories about, their weight loss or they're feeling better. And it just kind of motivates you to hear other people that are achieving their health goals alongside you. So I think there's some of that going on as well.
Interesting. So how do you pay for this? Is it a direct to consumer model? Are you working with payers? Is it employers? Or, what's your approach to business model? Like how can people get the service?
There's several different models. Right now, we earn most of our revenue by selling it to self-insured employers and health plans.
Okay.
And so they would pay us based on a performance-based payment model.
Right.
For example, they might pay up to $800 per employee based on milestones like the participant signing up. That's when they get a wireless scale. Attending 2 classes with the dietitian. That's when they get a Fitbit. Attending 6 classes with the dietitian. That's when many employers will provide a health savings account contribution as an incentive. And then the last milestone is 5% weight loss. And so typically when we work with these large self-insured employers or commercial health plans, we're submitting claims at each of those milestones using the diagnosis code for prediabetes, as well as the CPT code for online diabetes prevention. So that's where most of our revenue comes today, employers and health plans, but we are expanding into 2 new channels. In January, we're launching it as a direct-to-consumer product where a consumer could pay a monthly subscription fee or use a health savings account or flexible savings account to pay for the program. And then the third channel is getting physicians to refer their patients because Medicaid will pay for the telehealth delivery of the diabetes prevention program in certain states like Illinois and California, for example. And so we're in the process of becoming a Medicaid provider as well.
And does that cause some troubles? I mean, or how do you work the group? So like, are you in a group with your peers from your same company? Is that good or bad? I'm not, I'm not sure if that's something they like or if something they don't want, right?
Right. We just mix the participants in with our whole book of business right now.
Gotcha.
And so they're usually not going to be in a class with someone that they know.
Okay. Interesting. And what are some of those challenges virtually, that you've experienced? Obviously, we've gone through a massive change. I mean, I just think about this interview right here. 6 years ago, I may have had to remote into your desktop and teach you how to turn on your webcam, and we both got on without blinking an eye, right? But how's it been virtually, and have there been some challenges that kind of surprised you or things you had to work through?
Yeah, I think that previously with telemedicine, you had bandwidth issues where 20 years ago, it would be very difficult because of just the bandwidth issues. But now technology has become so much more advanced. It's not so much an issue, particularly with Zoom. We were actually using a different video conferencing engine a few years ago, which was not designed well for group video visits. And so now we are using Zoom, which everyone has become so accustomed to during the pandemic. And it's become second nature, which has certainly made it easier for us because everyone's so familiar with the core of our product, which is Zoom. I actually met the CEO of Zoom right before the pandemic, and both his parents had diabetes as well. So I know this is important to him, but I think we've become just so familiar with using Zoom that it's kind of made our jobs easier. And then Americans have gained so much weight over the course of the pandemic because of high stress, staying from home and not being as active, stress leading to poor eating choices. And so I think that now that we're starting to have the pandemic improve in terms of the situation, people are really interested in taking care of their health and losing some of the weight they may have gained during the pandemic. I know I certainly gained some weight as well. Yeah. But now the issue is not so much the technology. It used to be that all of these telemedicine companies would, build this complicated software to solve the technology issue. But now a company like Fruit Street is not really selling technology. We're selling healthcare services and clinical outcomes. We employ 175 dietitians that deliver this service. And so it's more of a tech-enabled healthcare service. And the challenge is not so much the technology, but the actual healthcare delivery now and building up a staff of healthcare professionals that are able to deliver a high quality intervention. And of course, the software helps, but the software is not 100% of the product. It's more about that dietitian delivering the service.
Sure. No, that makes sense. I think the other challenge maybe there is the wearables you talked about. How's it been sending those scales and Fitbits to the participants? Has it been a challenge getting them to connect it, or what's been your experience using those, and how does that and then maybe let's talk about how it influences the program.
Well, one of the issues during the pandemic was that there was a global semiconductor shortage. And so there were supply chain issues for quite a while, and we had to shift back and forth between different scale vendors.
Oh, that's interesting.
And then some of the scales are set up where all that the participant has to do is put the batteries in, and it's connected through a cellular connection. And that's very convenient for the participant because, again, they just put the batteries in.
Right.
But with other scales, it's Bluetooth, which can be challenging for people, or a Wi-Fi connection as well. And so we found that the cellular chips are the most convenient for the consumer. They're a little bit more
I was
expensive.
gonna say, are they worth the cost? That's the key question, right? Of course it's been.
Yeah. And we did run an analysis, and it is worth the cost. So, you also want to keep these enterprise clients happy. You don't want to hear, complaints from their employees. You want to make it
Sure.
as easy for them as possible. And so that's one of the, things, is the cellular connection, just make it much more convenient for people rather than Fitbit and Wi-Fi.
Yeah. And then how does it impact? I mean, is it part of that? I mean, I guess if, it sounds like it's every 2 weeks throughout the year, because 26 times for over the year, or is every week, but do they check in with that data each week as part of the group program as well?
So it's weekly in the beginning, and then it goes to bi-weekly and monthly.
Okay.
Eventually, the goal is to get people to 5% weight loss by the 6-month mark. And then the last
Okay.
6 months becomes more of maintenance. And the classes themselves are more about the actual curriculum and the content. Certainly, people might share success stories about the way that they've lost, for example, but the coaching you receive from the dietitian about your specific diet is often more so happening asynchronously, where you're taking a picture of your food and you're getting feedback from your dietitian in the form of a comment or a push notification. And then you're also privately text messaging with the dietitian one-on-one, as well as there's a separate group chat as well. And so the weekly classes are not necessarily reviewing the individual data of the 30 people, but talking about that content for the week. So sleep or exercise or stress management, as well as setting goals for the week as well. And then a lot of the more individualized coaching happens asynchronously.
Mm-hmm. So as you kind of scaled this across, populations, and this is maybe one of the takeaways we've experienced lately too. But have you bumped into any cultural considerations that you had to navigate that maybe surprised you?
Yeah. So, I mean, this one's not surprising, but we've started to put it in other languages like Spanish
Okay.
as well. But I think the big issue with diabetes prevention programs is that the standard version of them maybe makes somewhat, generic food recommendations, like have, salmon and broccoli, for example, right?
Yeah.
But there's people from cultures all around the world where that's not how they eat, right? And so if you have somebody with, an Asian background, or they like Indian food, or they're Jamaican, or whatever it is, right? There's so many different ways people eat throughout the world. And so the standard food pyramid is not what's relevant to them. And so if you actually look, there's dozens of different food pyramids around the world from different cultures. And so one of the things we're working on for this 2022 is to actually implement having dietitians from different cultures and making it a real priority, so that you could potentially match people with dietitians that have a similar cultural background, so that they understand their food preferences, but also to make those dietary recommendations relevant to what their specific dietary preferences are. And so we're working with a partner called Diet ID, which is a company started by Dr. David Katz, where they do a baseline dietary risk assessment, and they kind of use pictures of food to ask you, how are you eating today? It's almost like an eye exam. And they ask you a series of questions. Do you eat like this or like that? Like this or like that? And then ultimately they would guide people to some food recommendations based on how they personally would like to eat. And I think that's extremely important, because if you're making, broad food recommendations to people without realizing what their cultural preferences are in terms of, that the food that they eat, it's just not relevant to them. And so I think that's one of the big challenges of diabetes prevention programs that's often overlooked.
Yeah, that's fascinating. So just as we wrap up, I was thinking about this, like, does this really scale to the problem? I mean, to be fair, there's not enough dietitians, and probably. So, I mean, give me an idea of how this scales. And I imagine the virtual helps with that as well. But how do you look at it from obviously diabetes is a huge problem, and how do you scale your platform to that?
It's actually very scalable, and that's because group visits are a powerful but overlooked healthcare tool. When you have a group visit, there's 30 people in a group, which makes it 30 times more scalable than a one-on-one visit, which also means you need 30 times less healthcare providers, and it's 30 times more cost effective. And so if we were to enroll 120,000 people in a year, we would only need 200 dietitians, because each dietitian can work with 20 classes of 30 people. So it's 600 people per dietitian.
Wow.
To enroll 1 million people a year, you would need 1,600 dietitians roughly. To enroll 10 million people a year, you would need 16,000 dietitians, which is they're there, they're available, right? And there's also it don't necessarily have to be a dietitian. Part of the CDC's program is training lay people as health coaches as well. A lot of our customers prefer using registered dietitians, but if you were to ask the CDC, they would say it's okay if other types of healthcare providers or even lay people take this 8-hour course because evidence shows that can work as well. And so you could train a workforce of 16,000 people and enroll 10 million people with prediabetes a year. And in 8 years, you would have enrolled all the Americans with prediabetes. But the challenging part is not so much the coaches, because that can be accomplished as I just described. It's the harder part is the marketing of how do you convince people that they're actually going to change their lifestyle and that they should participate. How do you market to people with different cultural backgrounds and ages and gender and all of those kind of things? So I think the more challenging part is not the supply of coaches, but it's getting people enrolled into the program.
Well, I think that's the challenge of healthcare in general, getting people to care about their health when they feel relatively healthy.
Yeah, exactly. You don't know you're pre-diabetic, right, until something happens. Same thing with hypertension, as well. A lot of these things, we don't really have symptoms until there's a big problem.
Yeah. Well, Laurence, this was excellent. You taught me a lot about how you're approaching diabetes prevention and helping a lot of people. So thanks so much for taking the time to share your perspectives about Fruit Street, and appreciate everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Laurence.
Thank you.